The respiratory viruses RSV and COVID are both making the rounds during one of the worst flu seasons in many years. This phenomenon has made such an impact, it's gotten its own name, Tri-Demic. Nationally, a lot of kids and seniors are going to the hospital. Today, we'll hear from Santa Cruz County Health Officer Dr. Gail Newel about how we're experiencing these viruses in our area and how we can stay healthy through the season. Stay with us. Joining me now is Santa Cruz County Health Officer Dr. Gail Newel. Welcome.
Thank you. So happy to be back with you again.
Well, we really thank you. We really appreciate you coming here today because we really need to understand this new danger, 3 viruses appearing at the same time, or what's being called a tridemic.
Right. Lots of different names, triple-demic, tri-demic. I've heard the 3-headed dragon. But nevertheless, yes, as you mentioned, 3 different viruses, all upper respiratory viruses.
Now, these 3 viruses, what I've read is that they don't usually happen at the same time. Is that what you're thinking?
Yeah, we usually get a little of the RSV and the flu every year, but not a big surge. And then we've got COVID-19 along with us for the 3rd winter in a row now. And we are experiencing upward trends in all 3 of these viruses at the same time.
Does anyone have a theory about why they are kind of coordinated? Seems like one's coming early and one's earlier and one's coming later, and COVID's just always here. Do you have a thought on that?
Well, in the Northern Hemisphere, we expect these respiratory viruses at this time of year. But we're extra worried about flu, influenza, and RSV, respiratory syncytial virus this year, because after 2 or 3 years of masking and social distancing, we just haven't had the usual exposures. So we have a lot more susceptibility to these viruses than we have in the past.
Yeah, that makes sense. So all the people that might have gotten them during that time didn't, and so now they're all vulnerable at once.
Right, and we're especially worried about our littlest community members. So generally, kids get their first RSV before the age of 2, and they can get quite ill, but usually they've developed good immunity by the age of 2. But now we're seeing kids up to age 5 who are getting RSV for the first time. So we just have a much bigger population of kids and people who have never been exposed to RSV before.
Oh my. So can you, I'm wondering why, now these are respiratory viruses and they seem to really take more of a toll on kids and seniors. Can you talk a little bit about why those 2 groups are more vulnerable or at least suffer more?
Yeah, well, that's at least true for RSV and flu, not necessarily for COVID. So we know that the young kids do pretty well with COVID in most cases. So that's some good news. But they do tend to be more susceptible to RSV and flu, as do pregnant women. So pregnant women tend to be a little bit immunosuppressed during their pregnancies. Their bodies are busy growing babies and not fighting off viruses. And so, yes, the groups we worry about most in these viruses generally are young children, elderly, and pregnant women.
So why are they harder on the elderly? Why are they more at risk?
Well, as we grow older, we develop all kinds of different chronic diseases. And so our immune systems just aren't as strong as they used to be when we were young, and make us much more susceptible as we age to any kind of illness.
I see. Of the 3, RSV, it's been around as you mentioned a few minutes ago, but it's the one we haven't heard a lot about before now. Probably parents have heard about it. But what should we know about RSV? What is important to remember?
Yeah, RSV is very common. As I mentioned, most of us got it before we were 2 years old or in our early childhoods. but it tends to develop variants just like flu, just like COVID, and it comes back around over and over again. And we probably all have infections of it annually or every few years at least, just moving about our usual business, and it doesn't bother us much. But we haven't had that immunity exposure for the last few years, same with the flu, so we're feeling it more. Our bodies are not as primed to fight it off.
Are there vaccines or treatments for RSV?
There are no vaccines for RSV, but there are treatments. So the kids we're most worried about, the people we're most worried about, but usually it's kids under the age of 5, are kids who are have chronic diseases, are immunosuppressed for some other reason, are especially vulnerable because of healthcare conditions or health conditions rather. Also, those kids under the age of 6 months are especially fragile, and any kind of preterm infants as well. So those infants, as soon as there may be a sign of RSV, we recommend that they contact their pediatric provider and get advice about whether or not they need to be seen and to get started on treatment.
Okay. Now, I read the other day that Pfizer has an RSV vaccine in the works. Do you know anything about that?
I've heard that as well, but it's not yet approved by the authorizing bodies.
Darn. Be handy now.
Years.
Well, I just want to talk a little bit more about children. The recent national figures show that 80% of hospital pediatric beds are full, and I was wondering how are we doing in Santa Cruz County? Do we have enough capacity for the kids here?
Well, Santa Cruz County is under bedded, I should say, and understaffed for pediatric beds. We've relied heavily on tertiary care centers in our neighboring jurisdictions like Stanford, Lucille Packard Children's Hospital, and UC San Francisco, and other tertiary care centers like Children's Hospital of Monterey Peninsula. So we haven't invested a lot in pediatric beds here. Dominican is licensed for 6 pediatric beds, and Watsonville Community Hospital has an additional 4. But 10 beds isn't a lot. The good news is that both of our hospitals here in the county have some capacity at this time, and a little wiggle room to expand that capacity by a bed or 2. In addition, the Bay Area is showing some improvement in pediatric ICU beds, and there is now some availability in the tertiary care centers.
Okay, well, that's good news.
That is good news.
Do our local hospitals have specialized equipment like ventilators for babies and children? It seems like they don't see many babies and children. So is that equipment available here? Should it be needed?
They have certainly NICU beds and ventilators, especially at Dominican Hospital. They have a pretty advanced neonatal intensive care unit. The state, however, has not yet allowed flexibility in licensing and bed use to expand it for older infants that might have RSV. And you can understand there's a lot of concern about mixing sick babies with preemie babies in NICUs, so that would need to be done carefully. And then the state has allowed adolescents and teenagers to be admitted into adult ICUs. And of course, there are ventilators there that could be used in our hospitals.
I see. So let's talk a little about the flu. You know, we're all familiar with it. It comes around every year, but this time hospitalizations seem to be way up. The California, sorry, the CDC says that 147 young and middle-aged Californians have passed away due to the flu, and that's 10 times more than the number who've been killed by the flu last year at this time. What do you think has changed?
Well, every year we lose a significant number of people to the flu. And I think we don't realize that. Pregnant women, young children, elderly especially, can die from the flu. And we need to be aware of that. I think what's different this year is the flu has started earlier. And so if you look at this date on the books, yes, there's more deaths at this date. I don't anticipate there being more hospitalizations or deaths overall in the season, however.
Okay. Now, the CDC also says that there are two strains, N3, N2, and N1, H1N1. Will that make an impact?
Every year there's a few strains that circulate around the globe. We estimate what we're going to need here in the Northern Hemisphere based on what's happening in the Southern Hemisphere of the same year. Sometimes we get it better, we get it a better match to the circulating viruses than others. And that has yet to be seen for this year. And then we always see influenza A and influenza B. And so far we're seeing a strong A. Generally B follows in 2 or 3 months.
Okay. Well, the one good thing about the flu, if there is a good thing, is that there is a vaccine for it. How do you feel about this year's vaccine? How effective do you feel it is?
We have yet to know strongly, but it looks like it's a pretty good match so far. And I think it really caught people off guard, though, with the early beginning, the early onset of the flu. So many people feel like they have until November 1 or December 1 or even the new year to get their flu vaccine. And this year the flu surge started at the end of October. And so I think some folks were caught off guard. So it's never too late to get a flu vaccine, but the sooner the better.
Okay. The final piece of this Tri-Demic, if you will, puzzle is COVID. And there is a vaccine, and many people have gotten it, although only about 11% of the people eligible have gotten their boosters. So, but many people have contracted it, so we do have. I'm thinking that means we must have some immunity. What is your thought of the impact of COVID this year?
You're correct that most of us have some immunity to COVID-19. The Centers for Disease Control estimates that most Americans have had some exposure, whether through a vaccine or infection. And as you mentioned, most of us got the primary series. So we did pretty well in Santa Cruz County with 6 months and up. We approached the 80% mark for the primary series of vaccines. And we really did well in terms of equity as well, with our lower quartiles in the socioeconomic status measurements doing just as well as upper quartiles in vaccination rates. North and South County pretty well matched, race and ethnicity pretty well matched. We are not doing as well with the most recent booster. So we're only in Santa Cruz County about 23% of eligible people with the current booster. That's a lot better than the national figure you gave, about twice as good as the nation, but we have a long way to go. So especially our young children, the 5 to 11-year-olds, and our South County folks, we just haven't been able to get good uptake of this current booster.
Well, yeah, I know it's too bad that people aren't anxious to get the booster, because it does seem to help. Hopefully,
yes, and there does seem to be a very good match with this current booster. Let's call it the bivalent booster. Some people call it the current booster or the up-to-date booster, but it's just one shot, not multiple shots. And it looks like a very good match for the current circulating COVID-19 variants. And the good news about this booster, not only does it prevent illness, hospitalizations, and deaths from COVID-19, but there's growing evidence, strong evidence, that it prevents long COVID as well.
Oh, I hadn't heard that. That is really that's good to know. Now, when you go to get a booster, they are calling it by a lot of different names, and there have been different boosters. But if you go now to get a booster, you're going to get the bivalent, the correct one, right?
That's right. The only ones who aren't eligible for that are the under 5-year-olds. But 5 and up, if you ask for a COVID booster, there's no choice. You get this one booster, so it shouldn't be confusing.
Okay. Yeah, it shouldn't be. That would be good. How can we protect our kids and our seniors and ourselves from these viruses this year, in light of there being 3 running around at once?
Well, I know that people are tired of hearing us say this, and we've talked a lot about it, but the most effective way to protect yourself and your family is with vaccines. So there's 2 vaccines we've mentioned, and 2 of these 3 viruses you can be vaccinated against: COVID and the flu. So the sooner the better, and you can get them at the same time. So one appointment at your pharmacy or your physician's office should do it. And same for any child 5 and up. And so that's our #1 recommendation. And beyond that, it's the same old stuff we've been telling everyone to do for the last 3 years. I know it's tiresome to hear, but good hand washing, washing down surfaces frequently, opening windows and doors, so good ventilation when you're gathering with people, or gather outside if it's not too cold. Wear a good fitting mask in situations that might be risky, such as close indoor gatherings, and stay home if you're sick. These viruses are all really easily transmittable, so we want everyone to stay home until they've been without a fever for 24 hours and their symptoms are improving.
Okay. Now, COVID vaccines are free, but flu shots are kind of pricey. Does the county provide any relief for those who can't afford them?
Most people can get a flu shot at their pharmacy for free or as little as $5. There's also lots of county clinics, pop-up clinics available for free flu vaccines for anyone who wishes to get them. And many employers will also be giving flu vaccines as well.
Oh, that's great. And Medicare, of course, covers flu vaccines for seniors.
Yes. Yes.
Well,
and Medi-Cal covers flu vaccines as well.
Okay, so there's no excuse to get your flu shot.
All insurances are mandated by law to cover flu vaccines and COVID vaccines.
So, Dr. Newel, is there anything that you think is important about this, either the convergence of these three viruses or any virus individually that we didn't talk about that you'd like to share?
Well, we talked about vaccines for flu and COVID, but we didn't talk about treatment. And all 3 of these viruses now have treatment options available. So flu, most of us have heard of Tamiflu. And if you're diagnosed with flu, and that's as simple often as a nasal swab that can test for all 4 viruses, so flu A, flu B, RSV, and COVID in one swab. Most physicians' offices and laboratories have that test. So easily done and can get the results very quickly. And that will help indicate which medication or treatment you might need. And so there's treatment for RSV for children and adults at high risk. There's treatment for flu for pretty much everyone. And then there's treatment for COVID for people over 50 and those who have chronic medical conditions that put them at extra risk.
Well, thank you for that. And Dr. Gail Newel, thank you so much for helping us to understand all this, the information about RSV, flu, and the COVID Tri-Demic. And thanks to those of you at home for joining us as well. For CTV, I'm Becca Reed.
Thank you.
Each year, flu infections send hundreds of thousands of people to the hospital and cause tens of thousands of deaths from related pneumonia, sepsis, organ failure, heart attack, and more. The raised risk of heart attack is particularly alarming, with risk going up 6 times within a week of a confirmed flu infection. The good news is that you can prevent the spread of flu. Everyone needs to be vaccinated to protect their health and the health of their loved ones. People ages 65 and older should be sure to talk to their healthcare provider about a high-dose or adjuvanted flu vaccine. Older adults are at the highest risk of complications from the flu because our immune systems decline. If you do have the flu, your healthcare provider may prescribe an antiviral drug that helps keep the virus from replicating and making the infection worse. While the flu can be serious, it can be prevented and its impact lessened. Talk to your healthcare provider and go to agingresearch.org/ourbestshot to learn more about vaccines and how they work. Influenza, more commonly called the flu, is a virus that affects the lungs, nose, and throat, and that spreads easily through droplets from coughing, sneezing, or talking. Symptoms of the flu can include fever, chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headache, fatigue, and sometimes diarrhea and vomiting. While most of us have had the flu or know someone who's had it, many of us don't realize how serious it can be. Each year, flu infections send hundreds of thousands of people to the hospital and cause tens of thousands of deaths from related pneumonia, sepsis, organ failure, heart attack, and more. The raised risk of heart attack is particularly alarming, with risk going up 6 times within a week of a confirmed flu infection, even in people without a history of heart disease. Infants, people with weakened immune systems, people from racial and ethnic minority groups, and older adults are at the highest risk of complications from the flu, including hospitalization and death. Risk goes up with age because our immune systems decline, and we are more likely to have chronic diseases, both of which can make it harder for our bodies to fight off infections and the complications that come with them. Thankfully, most young and otherwise healthy people who get the flu will recover in a few days to less than 2 weeks without any serious complications. But while they recover, they often miss work and can't care for their families or deal with their other responsibilities. And even if their symptoms are mild, they are still contagious and can get other people sick who might be more vulnerable to serious complications. The good news is that you can prevent the spread of flu by hand washing, covering coughs and sneezes, avoiding others when you're sick, and getting a flu shot each year. Vaccines work by giving the body instructions for fighting back against bacteria, viruses, or other infectious organisms. While the flu vaccine can cause arm soreness, muscle aches, and fatigue in some people, side effects are generally mild and go away on their own. Severe side effects are rare. And despite what you may have heard, the flu vaccine can't give you the flu. If you feel a little under the weather after your vaccine, this indicates that it's working and causing your body to build up protection. Remember, it would likely be much worse if you got the actual flu. Everyone needs to be vaccinated to protect their health and the health of their loved ones against potentially serious infections, because as more people are vaccinated, there are fewer opportunities for an infectious disease to spread. The flu vaccine is needed every year because it is updated annually to best fight the constantly changing virus circulating in your community. Because people of color may be at higher risk for serious flu complications, the flu vaccine is especially important for them. There are a number of different flu vaccines available that differ based on how they're developed, how they're administered, and how they boost the immune response. People ages 65 and older should be sure to talk to their healthcare provider about a high-dose or adjuvanted flu vaccine. The high-dose vaccine contains 4 times the dose of a regular flu vaccine, causing a better immune response than a regular dose. The adjuvanted vaccines include ingredients that help create a stronger response. Flu vaccines have been rigorously tested and then determined to be safe and effective by the U.S. Food and Drug Administration. While the effectiveness of flu vaccines does vary from year to year, every year they keep millions of people from getting the flu and prevent tens of thousands of hospitalizations and thousands of deaths. And for those that get the vaccine and still get the flu, their symptoms are usually milder, their risk of complications is lower, and their recovery is faster. Protection from the flu vaccine decreases over the flu season, especially in older adults. In order to be best protected through the whole flu season, the ideal time to get vaccinated is by the end of October. If you're due for other vaccines, like a COVID-19 or shingles vaccine, it's okay to get them in the same visit. Getting a flu shot is a proactive step you can take to protect yourself and loved ones and help reduce symptoms caused by influenza that resemble COVID-19. You can get a flu vaccine at most healthcare provider offices, neighborhood pharmacies, health departments, community health clinics, and in some workplaces. Most health insurance plans, including Medicare, cover the flu vaccine with no additional cost to you. If you or a loved one is experiencing flu-like symptoms, call your healthcare provider right away. They can give you a quick test to determine if it's the flu or something else. You may also be able to use an at-home test to see if you have the flu or another infection like a cold or COVID-19. If you do have the flu, your healthcare provider may prescribe an antiviral drug that helps keep the virus from replicating and making the infection worse. They work best if started within 48 hours of your first symptoms, so call your provider early if you think you have the flu. Antiviral drugs often lessen symptoms, shorten the recovery time, and prevent complications. In certain situations, some can even prevent infection in people that you've been in close contact with, like your family members or coworkers. They can also have side effects, and not everyone should take them, so talk to your healthcare provider to see if they're right for you. Don't skip your flu vaccine this year, and if you do get the flu, stay home except to get medical care. Keep away from others and watch for possible emergency warning signs. If you experience any of the following symptoms, get medical help immediately. Warning signs may be different in children. While the flu can be serious, it can be prevented and its impact lessened. Talk to your healthcare provider and go to agingresearch.org/ourbestshot to learn more about vaccines and how they work.